Studies have shown that patients who are better educated about their health conditions are more compliant with their treatment programs, but more importantly, have better outcomes.
To some people with all kinds of disabilities, you got there are also people without disabilities.
I've lived with triple diabetes since I was 5 years old, and I became an advocate because I went through my own experience of having been living successfully with it and finding out that the medical community wasn't coming up.
I want to really leverage my experiences and social experiences for people in that adolescent to young adult range, basically, depending on what I
I'm the parent of 4 kids. The younger 2 are type 1 insulin diabetics. When they were first diagnosed, online contacts helped us a lot with the emotional side of it. And there's no place that I can have a repository of all that data and add that to, well, is it data of increased physical activity that affects blood sugars? Are they taking standardized tests at school that can do stress that affects blood sugars? My daughter menstruating, that affects her blood sugar. All that data should be the patient's.
I tested positive for HIV as soon as the test came out in 1985. Patient, by the way, is derived from the Latin term meaning to suffer, or sufferer. And I don't suffer much.
I was diagnosed with MS in '88, and I can tell you even 20 years ago, there wasn't much out there.
My name is Tiffany, and I've been diagnosed with lupus January 2010, and there was no cure. Why haven't I heard about this? Why does no one know what lupus is? And that's when I took towards the internet. Being online sort of gave me that sense of, you know, family, or there's other people out there that's just like me.
Okay, no problem. Shared access to own data. I don't know what that means.
Because people don't see the internet as a healthcare environment, but it really is. We're making it so.
The elephant in the room is the patients that you see at the table.
This is us taking a seat at the table. And therefore,
The patient has to be involved.
Really, it's not us and them. Everyone is eventually a patient. So when we're talking about patient rights, we're talking about human rights.
I think that we have the right as consumers for transparency online from healthcare professionals and pharma. I'd like to know who these messages are coming from.
So medical ethics is a whole concept of autonomy, that every individual is an autonomous entity that can control their destiny, and that's part of medical ethics, and just never trickle down.
If you are a publisher, if you are making recommendations, if you are evaluating things, if you are collecting data and making reports and doing like my website, then I think I have a responsibility to say who I am so that you can check that out.
That leads to information. As a consumer, I should have access to unbiased information, research. I need to be taught by my healthcare professional on how to tell my story. Yes, I have we all know our story, but teach me how to tell my story so that during that 20-minute encounter with you, I'm telling you the most relevant information. It's not just about pain, it's about what kind of pain, so that you can now help me pinpoint how to go about troubleshooting etc.
Our experience as consumers is legitimate and of value to other consumers.
concept of firing a doctor is alien in our society.
But since we're all patients and we all get sick, and some of us are professional patients, patient input is needed in every phase of healthcare.